Hello, good evening, everyone. Welcome to our Facebook Live on test taking strategies and also some tips for the NCLEX, next generation NCLEX. We have chosen a special topic for tonight to discuss a little bit quickly, and then hopefully that you will learn something. Now, before anything else, I would like to introduce myself. My name is Mr. Alan Matus, and I'm a nurse educator. I've been teaching for so many years, and I've been helping nursing students pass their licensure examination. So right now, I'm a nurse educator in a hospital, long-term acute care, and at the same time, I work part-time as a nursing faculty. And of course, I also wrote a book. So I'm an author. I wrote the book Simple, Fast, and Easy NCLEX Review for NCLEX PN and then also RN. So I just have my new edition coming out this year. So welcome everybody. I would like to welcome some people that we have here. Geoffrey, we have Alma. Alma is my student right now for the upcoming review program. Then also we have Arlene, we have Geoffrey, and also some other people in the viewing section. Okay, so without further ado, let's go to our first announcement, quick announcement before we go to our practice questions for tonight. Just announcing very quickly that we have the Happy Mother's Day special that's going to be on April 25 to May 14. So we have this usual 50% off. So we have the 50% off 249 instead of 499 for our self-study program, and that comes with a free workbook that I'll be sending you guys. So if you want to grab the opportunity, that would be 50% off, and that's going to be only until uh, May 14 only, everybody. So hopefully, if you get the workbook, please do it as soon as possible because we have a few remaining workbooks only, everyone. So we still have remaining workbooks that we're giving away for free. So let me know in the comment section, or you can send us a message, if you are willing to take the workbook. Now, there's also a coupon code that you can use at checkout. It's RN 50% off or PN 50% off, everyone. Okay. And then another one, of course, for next week, we're starting our 4-day fast track next gen NCLEX review webinar. So we have these May 4, May 11, May 18, and then also May 25. The 4-day fast track is a highly intensive review focusing on nursing content, core nursing content. So we'll be discussing here the most frequently asked questions in the NCLEX, and you will also have online learning resources as well. So again, this is a fast track review of the frequently asked topics, and then of course you have access to the online resources to watch additional topics, and then at the same time you will receive a workbook that we will ship to you, everyone. So this comes with a workbook. Okay, so enroll early so we could ship your workbook. And then also we have our self-study program, Next Gen English Review course. If you are so busy, then you can also take our self-study Next Gen English Review course. So it's an interactive core content review. It has videos. It has the workbook as well, so you can purchase the workbook. So unlike other programs, our program for self-study comes with review material. So which means to say you're not going to sleep while watching my videos because there's a workbook which is around 400 pages and that will help you review your content, everybody. Self-study next gen NCLEX review webinar. And then, yes, thank you, Lorena. Hi, Lorena. So Lorena Malanog. Okay. And then we have Doors Dada. Hi, sir. It's me, Francis. Okay. Hello. Okay. So it's been a while that we haven't had a Facebook Live, but now that I'm available, then we can go back to Facebook Live. Now, also, I released recently my new editions of my book, which is a simple, fast, and easy NCLEX review. So now I have two books. I have the next generation book. So this is a new published book that you can get from Amazon. Barnes and Noble online, and also other resources. If you Google online, this is available in a lot of online stores, not only in Amazon, but also Barnes and Noble. You can get this from Target, from Walmart. It's all over the place. So what you can do, so this is the NCLEX RN book, everybody. Okay. And then we also have the NCLEX PN book. So I'm going to show this to everyone every week. So this is the NCLEX PN book, everybody. And it says past and next generation NCLEX for practical nurses. I'm going to share also in the link section. If you want me to sign the book, then you can also order from me directly. So who wants to have a signed copy of the book? Okay, who wants to have a signed copy? They can order. I'll put the link in the comment section, everyone. Okay, and then this is for the RN, and it's a very nice book, everybody. Easy to read. Okay, and it's very colorful as well. Okay, all right. So it took me a while to finish the book, but finally it's out. And then, of course, if you have the time, I would like you to share or subscribe to our YouTube channel, okay, Matus Nursing Review, or share this in different Facebook groups as well so that others can benefit. What I'll be doing tonight is I'll be sharing with you a very important topic for the NCLEX, but it's going to be more of how are you going to prepare for this kind of topic? How are you going to study these topics for the NCLEX? And just to give you an idea tonight, everyone, our topic is going to focus on arrhythmias. Now, I know most of you, your number one fear in taking the NCLEX is going to be arrhythmias or dysrhythmias. A lot of you wants to be really very familiar with and how to answer these questions. So, without further ado, let's have your practice questions. Are you ready, everyone, for our practice questions for tonight? And this will be all about arrhythmias. Okay. I work in the long-term care hospital right now, and the educator there. And of course, part of my responsibility is to train staff on how to carry out cold blue. So for Cold Blue, we need to train staff on the different types of arrhythmias and how to manage them, especially in cases of emergency. We also have a telemetry unit where we have patients with telemetry and they're being monitored by our monitor techs and nurses. So before anything else, a quick review all the time. Your next gen NCLEX test design, of course, everybody, you know this, right? You have 85 questions with a maximum of 150 questions, 15 non-scored questions, a maximum of 5 hours, and a minimum is you're gonna have 3 case studies with 6 questions each. So when you take your exam, and the first 85 questions will be 18 questions from your next gen case studies. And the exam is still mostly composed of classic question formats, your multiple choice. And now there's partial credit points for some questions, especially your select all that apply questions. So you now receive partial credit points. Okay, now if you want to know more about the next gen NCLEX test design, I have a specific video in YouTube about next gen NCLEX, discussing everything about it and also in our program. Always remember your one case study for the next gen will have 6 questions, right? And the 6 questions will focus on six cognitive level. So the first question you will have is going to be all about recognizing cues. The second will be analyzing the cues. The third question will be prioritizing your hypothesis. Then you generate your solutions, and then you take actions, and then you evaluate outcomes. Okay, hi Tamika, good evening. All right, okay. Thank you for being here and watch out for our next Facebook Live because we're gonna have some raffles. Who likes to win something, everybody? Do you want my book? Do you want online access to my review program? Okay. Okay. So, everybody, are you ready for our first question for tonight, everyone? Let's see who can answer. And in our next few Facebook Live, there will be prizes. Okay, so make sure that you share it. So let's just have your first question for tonight. Okay, about our first NCLEX challenge question is going to be about. Let's read the question. While waiting for an automatic electrical defibrillator device or AED, which nursing action is most essential to perform on the pulseless unconscious client? So is it A, initiate CPR, B, give to full breaths every 5 minutes, C, insert an endotracheal tube, or D, lower the bed height? Okay, so when you have a client, so while waiting for an automatic electrical defibrillator device, which nursing action is most essential to perform on a pulseless unconscious patient? Is it to initiate the CPR, give two full breaths every 5 minutes, insert an endotracheal tube, or lower the bed height? What do you think? What is your algorithm for the basic life support? When you review for the NCLEX or Next Gen NCLEX, it's very important that you review your basic life support algorithm and then also your ACLS algorithm, especially for the ones taking the RN exam. If you're an LVN or LPN examination, then you have to master the basic life support. Now, for the RN, master your ACLS or advanced cardiac life support. So again, when you review for the NCLEX, make sure that you review what is BLS and what is ACLS and what happens in ACLS. ACLS basically is when you do a code blue. Okay, so the first thing that we have to do, the answer to this question, guys, is going to be letter. Okay, let's see. Okay, so what will be the answer to this question? The answer will be, of course, letter. Okay, so that would be letter A, everyone. Very good. Star French is letter A. All right, Kathleen also got it right. Geoffrey, you also got it right. Tamika, you also got it right. Very good. Akel Paspi. Very good. You just passed your first question for the NCLEX. You have to initiate CPR. Always remember that whenever you have a patient who has a cardiac arrest, the first thing that we have to do is rapidly to initiate CPR. But then also remember, everybody, before you do CPR, what do you check? That's my question. What do you check also before you do your CPR? What is very important to check, everyone, before you do your CPR? What is very important to check? So you call for help, of course, you call cold blue, but before anything, what do you need to check before you do CPR? I know you have to check the pulse. Yes, that's correct. Before, make sure your patient has no pulse. That's correct. You need to make sure somebody's getting the external, the automatic external defibrillator device. Okay, the pulse, but don't also forget what else? Safety. Okay, there's something else that you need to make sure that you have to check or you need to know before you call a code blue. Check for the patient's what? The patient's code status. Okay, so you check the patient's code status in practice. That's really very important. Okay, check the patient's code status. Okay, so the code status is very important. Is that important, everybody? Yes. So most likely, if you're a nurse in the unit, you already know if the patient is no code or if the patient is full code. Yet consciousness is also very important. That's the first thing that you have to check if the patient is conscious or not, right? And then you check the pulse, and then after that you or the breathing as well, and then you call the code. But it's also very important to check if the patient is a bracelet and if the patient is DNR or if the patient is full code. Okay, and then of course you can initiate your CPR with a cold blue team as well. All right. Okay, so just that knowledge is really very important. Knowing your patient is full code or no code. Okay, and then of course you always have to do CPR. Okay, that's important. No delays in CPR. All right, so let's go to the next question, everyone. But before that, this is irrational. CPR should be performed when a client has a cardiac arrest. CPR keeps oxygenated blood flowing to the brain and the heart until a defibrillator or emergency team arrives. When started immediately following cardiac arrest, CPR can double or triple the victim's chance of survival. Okay, very good. All right, so that's it. And usually, what CPR do we have? We have a ratio of what? Okay, two people doing the CPR, right? If you have two people doing the CPR during a code, it's very important to switch every 2 minutes. Or when someone is, or the person is already very tired, then you have to switch. Or you can switch every 2 minutes. And the quality of CPR is very, very important. Okay, very important. So let's go to our next question, guys. We're gonna have next question. Okay. Number two, are you ready for your rhythm, your tracing? Okay. This is your tracing, everybody. So the nurse is evaluating the client's rhythm strip, which intervention is required based on these results. When you see this rhythm, everyone, what kind of rhythm is this? There's an absent Q wave, no QRS, only wavy or spike baseline. It's very hard to determine where's the P, where's the Q, where's the R, where's the S. There's nothing. It's just really wavy lines. It's it, it is not discernible. It is very hard to determine, and all you see is just this tracing. So, what are you going to do? Is it cardioversion? Is it defibrillation? Or pacemaker insertion? Or a maze procedure? Okay, so look at the tracing. The nurse is evaluating the client's rhythm strip, which intervention is required based on this result. Okay, so when you see this in the NCLEX, which is really very common, what is this tracing that you're seeing, everyone? Okay, because you will definitely have these kind of questions. When you have the picture and you have to identify what tracing is present. Okay, so most of you are putting defibrillation as the answer. Okay, let's see. All right. Okay, now can you rationalize why defibrillation? Okay, some people are still answering. Thank you very much. We have a lot of viewers now. Okay, guys, um, can you also put your location though? That would be good to know where you're located right now. Okay, are you in Florida? Are you? I want to see some people outside the country. If you're outside the country, that would be good. I saw somebody earlier from Jamaica. Okay, I want to visit Jamaica. I want to visit the Caribbean. Okay, so maybe I'm going there. Then I could see you, right? And then I could sign a book for you. Okay. All right, so the answer, let's see. This is a very common question in the NCLEX, everybody. So from Florida, Francis, Kathleen is from California. Okay, all right. So let's get the answer, guys. Are you ready? Okay, so when you see wavy lines, this is very common in the NCLEX. I'm sorry to say, everybody, but this is not a VTAC. This is not ventricular tachycardia. Ventricular tachycardia looks like mountains, okay? Looks like mountains, okay? So this is just wavy lines. Yes, Star Friend says course ventricular fibrillation. Okay, we have Abu Dhabi, UAE. I want to visit Dubai, or is it Abu Dhabi? That's different, UAE. All right. Okay, so again, later on, I'm going to share the link to my book if you want to have a signed copy. And I'm going to share that with you guys, the signed copy of my book. Okay. All right. So the answer for this, everyone, is going to be okay. That would be letter, okay, letter B. No, it's not cardioversion. Okay, the answer for this, everyone, is defibrillation. It's just a wrong highlight. Okay, defibrillation is the answer because this is ventricular fibrillation, everyone. So B is the answer. We go back to this. Okay, the answer is letter B. All right, so you're correct. It's defibrillation. And also very important in the NCLEX, everybody. You should remember B is the answer. But remember in the NCLEX, if What are you going to do? This is my question, everyone. This is my question. What are you going to do if the defibrillator device is not available? What if you don't have the crash cart yet? What should be done? Well, the crash cart is not available. Okay, crash cart is not available. So what are you going to do if the crash cart is not yet available? Hmm? What will you do, everybody? So, for example, the patient coded, and then, of course, you call a code blue, and then it takes a little bit of a while before the crash cart arrives. So, what are you going to do? You already know your patient is pulseless. You know your patient is pulseless, and you know your patient is unconscious, no breathing. So, what are you going to do? Very good, Tamika. You have to do a CPR. Always remember that CPR. Okay, CPR. Now, I have to make this very clear, everybody. Okay, I have to make this very clear. Now, if the question in the NCLEX is what is the number one intervention for ventricular fibrillation, of course, the number one is defibrillation, not CPR. Okay, the number one is defibrillate your patient immediately. That's why when the crash cart arrives, you put the backboard, okay, you put the backboard and then you put the pads, and then immediately you have to read the rhythm because we need to defibrillate. But if the question in the NCLEX is if the defibrillator is not available yet, then you have to do your CPR definitely. And it has to be high quality CPR. You may have questions in the NCLEX. What is the correct way of doing CPR? Okay. In some situations during a code blue, there's someone that we assign to make sure that the person doing the CPR is doing it correctly. Now I have an additional question for everyone. Let's see if you can answer this question, everybody. Okay, so that you will realize tonight that there are other things that you need to know. What are the different roles in a code blue? So, how many people do you need in the room? That's my question. When you have a code blue, how many people do you have in the room? And what are the roles of those people? Who are those people? When you have a code blue and when you have the code team in the hospital coming over, what are the different roles in a code blue? Can somebody give me? You're going to have around six, probably, people. Okay? So, what are the roles in a code blue? Okay, so the first thing you're gonna have is, of course, you're gonna have your, what do you need number one? Number one is you need a team leader. Very good. You need a team leader, June. Okay, you need a team leader who is very important, is gonna be the one assigning roles, or let's say prior to the code blue, there's already designated roles for each person. So there's a team leader. The team leader comes in with a whole group. You have the crash cart person, you have the medication nurse, you have the compressors, the ones who will do the compression. How many people do you need to do compressions? You need at least two, right? Because they're going to switch. You need an airway person. An airway could be a respiratory therapist to do intubation, or it could be another physician. You need a timer or recorder. Very good, June. Okay, a timer or recorder as well. And what is the purpose of the recorder? The recorder is going to record, okay, the time or the duration of the CPR, the time defibrillation is done, or when the medications are being given, we also need to know the medications, the time. Very good. And don't forget, one last person that you need is going to be a runner. Okay, a runner is someone who's just really available, and if you need something like a glucometer, for example, or additional oxygen device, the runner can go up. You don't want to crowd the room. Okay, people are supposed to stay outside. You don't want to have 20 people inside the room. Sometimes that happens. Okay. So only those people inside the room, everybody. All right. Okay. So we do defibrillation for a client with ventricular fibrillation. So we do CPR, then defibrillation, then again after 2 minutes. So after how many minutes do we check again the rhythm after shocking the patient? Okay. After shocking the patient, we check again for 2 minutes, right? Very good. Rhonda is to get new things. Very good. After 2 minutes, you check again the rhythm, and then you have to defibrillate if the reading is ventricular fibrillation still, okay, or unstable beta, for example. So my point tonight is you may not be able to learn everything, but it's just that, again, I'm telling you what kind of items you're supposed to study for your NCLEX. Okay. Now my question is, if the defibrillation is not effective, you have another defibrillation, then we have to give a medication now. What is the first medication that we give? What is the first medication that we give? Okay, to after the first defibrillation. Now you have to do another defibrillation, but then we now start that medication. So what is that first medication that we give after the first defibrillation is not effective? All right, what's the medication, especially for the RNs? This is your ACLS or advanced cardiac life support. Is it epinephrine or is it amiodarone? Okay, is it epinephrine or amiodarone? Of course, number one is going to be epinephrine, everybody. Very good, June. Very good, Lorena. There's going to be an epinephrine. Can somebody tell me how many milligrams of epinephrine is going to be? And that's why if you're the medication nurse, you need to make sure that you know where the medication is. You know, where's epinephrine there in the crash cart. You need to study. So epinephrine, and then if it's not working after another shock, then that's where you go for amiodarone. Okay, amiodarone, and of course you need to know the dose. I'm not really very sure right now. I think it's 150 or 300 milligrams of amiodarone, I guess, but I'm not sure. But epinephrine, I guess, is 1 milligram. So just double check the doses, everybody. Okay, but I'm very sure it's gonna be epinephrine and then amiodarone. Okay, all right. So that's it. I hope you learned something. All right. Now, is there something else that I need to remember? But also don't forget to remember that when you're doing a code, it's very important to lower the height of the bed. Okay? All right. So let's proceed. Now, my question is, if you're doing a code and there is no IV access, what is our next option? What is a possible option if the patient has no IV access? What's your option, guys? We need, most likely in the hospital there will be IV access already, but for some reason this patient has no IV access. What's gonna be? Okay, what's gonna be? So there's a question, is this review every day? No, we just started again. So we will try. So visit my Facebook group, Facebook every day. Okay. Visit for announcement, especially the like button so you get notification. We schedule this usually every Thursday, everyone. Okay, Thursday. So, all right. So your option, very good. Arlene said intro osseous. Okay. So the bottom line is osseous means it's hard to spell, right? Osseous means the bone, right? Interosseous is the bone. So that's gonna be another option. Just FYI. Okay. All right. The bone or IO. If there's no IO, then no IV, then you go for IO every one. Okay. Okay. So let's proceed, everybody, to the next question. Okay. So that was defibrillation is the answer. Okay. So rationale for this question, ventricular fibrillation is characterized by absent P wave and wavy lines. It is treated with unsynchronized shocks, also referred to as defibrillation. Cardioversion is not possible with ventricular fibrillation since it is chaotic, disorganized rhythm. So for defibrillation, for ventricular fibrillation, we really need to do defibrillation. Okay, so remember the saying. The saying is defib for vfib. Okay, defib for vfib. And at the same time, when can you do also defibrillation for ventricular tachycardia? Okay, but the ventricular tachycardia must be classified as pulseless unstable ventricular tachycardia. So whenever you're studying ventricular tachycardia, you need to know if it is a stable ventricular tachycardia or is it unstable. Okay, unstable means it's pulseless, vital signs. Okay. Yes, Ivy said, can we go back to listen to the lesson? Yes, it is. This is in our Facebook. Okay. All right. Now, one question as well, everybody. Very important. Okay. Another question that's very important here, everyone. My question is, okay. My question is, all right. My question is, always remember that some rhythms are shockable, are not some rhythms are not shockable. So always remember, everybody, that some rhythms are shockable, meaning that you can shock your patient, and some of them are non-shockable, everyone. Okay, what do you see in the movies? What you see in the movies all the time is that when the patient is cardiac arrest, we always shock the patient, right? That's what you see in the movies. But remember, in your ACLS algorithm, you Google that. In your ACLS algorithm, you have shockable or non-shockable rhythms. Okay. Now, ventricular fibrillation is a shockable rhythm. Your ventricular tachycardia, unstable or pulseless, is a shockable rhythm also. Okay, you can shock your patient with those. But my question is, give me examples of non-shockable rhythm. What rhythm we're not shocking your patient? We're just giving medication. Okay, for example, it's not VFib. For example, it's not unstable ventricular tachycardia. Am I right? So, what are non-shockable rhythms? Let's see. And also, guys, for next week, if we have a schedule, you share with your classmate, or friends so they can attend. So maybe they will learn something. Okay? Because I get feedback from students about difficult topics in the NCLEX. Okay, very good. So a non-shockable rhythm is your asystole. Very good. Or flat lining, guys. It's non-shockable. Okay? Flat lining. So it's an emergency, but we don't shock the patient. And then there's another one that you don't shock your patient. If it is what? Very good, Arlene. Another one that we don't shock is your PEA, or pulseless electrical activity, meaning that you can see an activity, okay, but there is no pulse. All right? So pulseless electrical activity and then a systole or flatlining. But the question that I'm going to give you guys is this. When you watch movies and your patient is a flatline, what do they show you in the emergency room? They show you that we're shocking the patient, right? For the flatline. But that's actually wrong. Okay, that's wrong. Because in your ACLS algorithm, the real thing is that for a systole or flatlining, we don't shock your patient. We do CPR and give medication. And again, my question is, what medication are we giving if we cannot shock the rhythm? What medication are we going to give if we cannot shock the rhythm? So in your ACLS algorithm, okay, what medication are we going to give? Since it's a PEA or a systole or flatlining. So again, June, very correct. That's correct. So we have to give your epinephrine as a drug of choice. All right. So this is my tip, everybody. I want you to visit the American Heart Association website, okay, or any other resort. You Google or you type ACLS algorithm, okay? ACLS algorithm. You also type BLS algorithm. What's the sequence of events when you are intervening? Okay, that's very important. All right, so let's now proceed to the next question that we have, guys. Are you ready for our next question? Okay. All right, so next question will be about number 3. The nurse is reviewing the EKG strip of a client in the clinic. The findings indicate a PR interval of 0.14 seconds, a QRS complex of zero point zero 0.08 seconds, regular P waves, and a heart rate of 70. These results indicate A. Sinus tachycardia, B. Second degree heart block, C. Atrial flutter, or D. Normal sinus rhythm. Again, the nurse is reviewing the EKG strip of a client in the clinic. The findings indicate a PR interval of 0.14 seconds, a QRS of 0.08 seconds, regular P waves, and a heart rate of 70. These results indicate A. So let's assess your knowledge tonight. This is an assessment. If you feel like you cannot answer the questions, then it means that you have to go back and review your EKG, right? So sinus tachycardia, second degree heart block, atrial flutter, or normal sinus rhythm. Can someone tell me, okay, what's the answer? All right, yes. So that's why it's very important, everybody, when you're looking at the EKG tracing, you should know where's the PR interval, okay? Where is the QRS? That's really very important, okay? All right. So the answer to this question, everyone, is going to be, okay. Can someone tell me the normal PR interval? The normal PR interval. Okay, then you have your QRS. So I want you to go back and look at the rhythm tracing, the normal EKG tracing. Where's the PR? Where's and what's the meaning of the PR interval? What's the QRS, for example, and what's the meaning of the P wave, for example? So the answer for this, everybody, is going to be okay. This is going to be, let's see, a normal sinus rhythm. Okay, normal sinus rhythm, guys. Why? The rationale for this is this. This tracing is a normal sinus rhythm. The normal PR interval is 0.12 to 0.20 seconds, which is very important to remember. Everybody remember that. 0.12 to 0.20 seconds, the PR interval. And then easy way to remember that is a young person, is from 12 years old to 20 years old. Okay, so 0.12 to 0.20, and the normal QRS is 0.08 and 0.10 seconds. So just really very short. And then the heart rate is within normal range, and it also is regular, everybody. So going back to this question, okay, all right, so the meaning of the P wave, just a review, what's the meaning of the P wave, everyone? P wave is when you have the atrial contraction, and then your PR interval is the time that it takes for the impulse to travel from the atria to the ventricles. So, what does it mean if your PR interval is 0.14? That's within the normal range because the normal is 0.12 to 0.20. Am I right? Now, what does it mean if you have a prolonged PR interval? What does it mean if you have a prolonged PR interval? For example, you're looking at the AKG and the PR interval is not 0.12 to 0.20. For example, let's say it's 0.25. It's prolonged. What does it mean? What's going on with your patient with a prolonged PR interval? It's longer than 0.20. What could be the condition of your patient? What's the problem? Okay, with a prolonged PR interval, the problem of your patient could be what? A heart block. Okay, could be a first degree heart block, everybody. Okay, especially with delayed or prolonged PR interval. Okay, So the QRS complex is a review. The QRS complex is the contraction of your ventricles. Okay, contraction of the ventricles. All right. So you have other options there: sinus tachycardia, atrial flutter. Okay. I know that you will review all of them. So this is just a quick review for today, for tonight. All right, so this is the last question for tonight, everyone. And as we move forward, we're going to have more questions, maybe about arrhythmias in the next few sessions as well. Okay? All right, so let's see. So the nurse notes that the EKG tracing of a client shows ventricular tachycardia. Upon assessment, the client remains coherent and stable. Okay? The nurse would expect which intervention to be done. Okay, which intervention will be done for this patient? So is it letter A, insertion of a pacemaker? Okay. Is it letter B, defibrillation? Letter C, is it administration of lidocaine? Or letter D, that would be administration of dopamine? Okay, again, the nurse notes that the EKG tracing of a client with shows ventricular tachycardia. Upon the assessment, the client remains coherent and stable. The nurse would expect which intervention to be done. Is it A, you're going to insert a permanent pacemaker, B, defibrillation, C, administration of lidocaine or xylocaine, or D, that would be administration of dopamine? What's your answer? VTAC. Okay, so if you want, one of these days, I could do a Facebook Live discussing the different types of arrhythmia. So we can do that. Okay. All right, so the answer to this question, everyone, is this. You have to remember when you talk about ventricular tachycardia, that is a rapid heart rhythm around 150, right? So very rapid rhythm. Sinus tachycardia is just above 100. That's sinus tachycardia, that's different. But ventricular tachycardia is going to be around 150. And it's really rapid rhythm. But in the NCLEX, remember that you have uh, two types of ventricular tachycardia. You have the stable and the unstable. A client who has stable ventricular tachycardia remains coherent, consciousness is there, and then the vital signs are stable. So for patients with stable ventricular tachycardia, we only have to give medications like lidocaine or xylocaine, everyone. Okay, or maybe later on doctors can decide cardioversion, but the first treatment for this will be administration of lidocaine. Okay, now letter A, insertion of pacemaker, everyone. Letter A is for heart block. Okay, pacemaker pacemakers usually inserted for second or third degree heart block. Okay, defibrillation, and then dopamine is not being given. Dopamine is to shoot up the blood pressure. You cannot give dopamine for someone with ventricular tachycardia because why? This patient already has tachycardia, so what's going to happen to the blood pressure is going to go up. Okay, so remember that when you're dealing with the different types of arrhythmia, if the heart rate is very high, then you need to give something to make it slow. If the heart rate is very slow, then you have to give it something to make it fast. Am I right? Can you give me some medications for bradycardia since we're already there? What are some medications that we can give if you have sinus bradycardia? Let's say below 60. Sinus bradycardia. For example, your patient is having the digoxin toxicity that lowers the heart rate. So what medications can you give to increase the heart rate? What do you think? Atropine, very good. Atropine is one medication. What else? What else can we give? We can give dopamine, right? We can give isoproterenol. Okay, we can give epinephrine. We can give atropine. So remember IDEA. IDEA is your acronym for treating sinus bradycardia. We're talking of sinus bradycardia. That's dangerous, you know. Sinus bradycardia sometimes is okay as long as you don't have any symptoms. But if you have symptoms, then we need to treat sinus bradycardia. For bradycardia, we can give medications, you know, idea. So I would be isoproterenol, D would be dopamine, E would be epinephrine, and of course, A will be atropine. So if you're going to be asking the NCLEX, what's the effect of these medications, your dopamine, epinephrine, atropine, they're going to increase your heart rate. All right. Now, my next question, everyone, what will be your medication for dangerous sinus tachycardia? More than 100, but your patient is having symptoms. So for sinus tachycardia, how can you lower down the heart rate? What drugs can we give for sinus tachycardia? What can slow down the heart rate? What medication? The medication starts with B, then you have letter C, then you have letter D. What are those? For tachycardia, what medications can you give? Yes, very good. For tachycardia, you can give your acronym for that, everyone, is going to be BCD. Okay, very good, June. So you can give for a very rapid heart rate, you can give beta blockers, you can give calcium blockers, and letter D would be your digoxin. Okay, digoxin. So again, my point, everybody, is you need to know which medications are given for tachycardia and what medications are you going to give for bradycardia, everyone. All right. In my book, I discuss all of this EKG. So this is just really a snippet of the most common information that you need to know. Very good. Okay. Now, my question is again, just remember defibrillation is only done for ventricular tachycardia that is unstable or pulseless, and then ventricular fibrillation. All right. Okay. So let's have the rationale for this. So the rationale is in a hemodynamically stable client with ventricular tachycardia, restoration of sinus rhythm is typically achieved with intravenous procainamide, amiodarone, or lidocaine. So we just give medication. Cardioversion may also be performed. Defibrillation is performed only for pulseless ventricular tachycardia, which is an emergency. So again, in the NCLEX, always remember that when you're talking of ventricular tachycardia, there will be two types of ventricular tachycardia. Is that clear, everybody? There's a ventricular tachycardia that is stable, and there's a ventricular tachycardia that is unstable. All right? So I hope you learned something tonight, everybody. Did you learn something, everyone, with our short session? Okay. Hopefully, can you please answer yes? All right. Well, I'm so happy we have a lot of viewers for our first Facebook Live after a while. Okay. Now let's proceed, everyone. Before I end for tonight, I just want to give you some tips on how to study for your next generation NCLEX. Okay. Now, remember in your NCLEX that normal EKG rhythm may be there. You have to go back to your anatomy of the cardiac conduction system. You know, how does it happen? You know, your cardiac conduction system, your SE node, AV node, the bundle of His, the Purkinje fibers, you know, and then you also have the Purkinje fibers, you know, the normal cardiac conduction system. In your NCLEX does not ask anatomy and science questions, but it's important for you to know anatomy. So you need to know the normal EKG rhythm, the normal strip, and don't forget also, guys, don't forget your seconds. So can you repeat again, everyone? What's a normal PR interval? What's a normal PR interval? You need to understand that. Okay. Can somebody write again? What's a normal QRS complex? The normal, how many seconds? You need to know that. You need to know the location of arrhythmias. Where do they happen? Are they ventricular? Yes, Tamika, 20 to 12 to 20. But just remember, 12 to 20 is very long. It's point 12 to point 20. Okay? The heart beats very, very, very quick. Is that clear? It beats very, very, very quick. And also, you can write down in the comment section what else are the other topics that you want me to teach. Okay? Can you write down, guys, in the comment section, any topics that you want to go over? Okay? So, you need to know if the arrhythmia is atrial. Now, ventricular arrhythmias would be your ventricular fibrillation, ventricular tachycardia, and also it would help if you can watch a video of the actual arrhythmias. Watch some videos, guys. Okay? Atrial arrhythmias could be your atrial flutter and atrial fibrillation. Okay? Now, you need to be familiar with how the EKG tracings look like. Like your ventricular fibrillation will be wavy, your atrial flutter. How does atrial flutter looks like, everybody? Atrial flutter, how does it look like? If you can remember, atrial flutter looks like what? Atrial flutter looks like um atrial flutter looks like they look like sawtooth, very good, or sharp teeth. Yes, so that's important. Okay, your VTAC looks like mountains, or your VTAC looks like tombs. Okay, all right. Now, antiarrhythmic drugs, be familiar with them, and also the most common side effects of antiarrhythmic drugs. With the antiarrhythmic drugs, you have the common side effects could be hypotension or low blood pressure. Then also you should know what rhythms are shockable and non-shockable, which I said earlier. And then also your ACLS and your BLS algorithm, especially your initial response when a client is unconscious and have a cardiac arrest. Okay, all right. Okay, and then lastly, before I go, okay, so some topics that you want me to cover would be your endocrine, SIADH versus diabetes insipidus. Guys, you can also join our group, Matus Nursing Review, NCLEX Support, and Practice Test. Matus Nursing Review, I'm not sure if you're already part of that group, but I will also do a Zoom session there. So if you want, okay, I can do some lectures there, the ones that you're asking. So aside from this one, I'll be doing also in Facebook group. So always join that Facebook group, and then also visit this, for the announcement all the time. Okay, and sign up also in our emails as well. Okay, Addison disease will be doing that. Okay, so you also want your maternity, your fetal heart rate tracings. Of course, we can discuss that very quickly. All right. Now, frequently asked arrhythmias would be yours. There's many arrhythmias, everyone, but you need to start with this arrhythmia when you're studying for the NCLEX before you start the others. Are you listening, everyone? You need to know sinus bradycardia and sinus tachycardia. You need to know atrial fibrillation. You need to know atrial flutter, ventricular tachycardia, ventricular fibrillation, study of premature ventricular contractions, and then also your types of heart block. And also remember, everyone, not all arrhythmias are life threatening. Is it clear? Some of these arrhythmias are harmless. Some of them could be managed with medication. So you need to know which ones are emergencies. All right? So everybody, thank you very much for your presence tonight. I really did enjoy our Facebook Live, everyone. Okay. Thank you very much, everybody. I really appreciate your presence for tonight. And again, okay, just remember our programs. And If you have any questions, shoot me a message or an email. It's either me or my staff will respond. And also, if you want to inquire about the book. Okay, and I hope you learned something tonight. And when you pass your NCLEX, can you please give me a message? And I would like to congratulate you guys. I want to give you a shout out here. Okay, so next one will be next Thursday. You just check the Facebook page. Okay, if there is an announcement, everyone. Okay, and maybe later on we can have some raffles. Do you want to win some prizes, everybody? Okay, who wants to have a free NCLEX review in my online class? Usually we put this class like less than 1 hour. We cannot prolong this. Okay. All right. Thank you very much and send us a message, everybody. All right. Thank you and have a nice night, everyone. Thank you.